My first guest is Donna Branca, the Director of Marketing and Public Relations at United Hospice of Rockland. Welcome, Donna.
Thank you so much for having me here. I appreciate it.
So we're very happy to have you on. You know, United Hospice of Rockland is just a tremendous foundational bedrock agency here in Rockland County. We're very happy that they call Clarkstown home, and with the Joe Rosso Hospice residents as well. And we've had Amy Stern on in the past, the Executive Director. Hospice is celebrating its 30th anniversary this year.
Yes, we are.
Amy's celebrating 30 years as well. And we're very happy to have you on to speak a little bit about United Hospice of Rockland in this segment. So maybe, Donna, you could give us just a little background about yourself. How long have you been with United Hospice?
I just celebrated my 5-year anniversary on August 13th this year at Hospice. My background is in the for-profit. I was at several corporations prior to switching to nonprofit. I guess back in 2009, I was in a major downsizing from a large corporation. I said, you know what, I think it's time to switch to nonprofit. Would like to do something that's maybe a little bit more fulfilling and staying close to home, being local as well. I grew up in New City, so I now live in Orangeburg. So between Clarkstown and Orangetown, those are my two homes. And my mother unfortunately used hospice. That was my first experience about 10 years ago. And they were just fantastic. And I said, what an unbelievable organization. And when the opportunity came up for this position, I jumped at it. So I was very excited to join the organization. That's
great. And maybe you could just talk a little bit about Hospice of Rockland, you know, some of the services that are offered.
United Hospice of Rockland is a not-for-profit. It's a community healthcare-based organization, and we provide hospice care at home, local hospitals, Nyack and Good Sam, nursing homes, group homes, as well as in the community at home and at our own Joe Rosso Hospice residence. So what that means is we have an interdisciplinary team approach. So we have nurses, we have a physician on site. Dr. David Chmielewski is our physician, and we have home health aides. We have therapy such as occupational, physical, massage, pet, music, numerous therapies to really provide comfort care to our patients, individuals, and their families. So it's really important. We have social workers, we have bereavement counselors for after someone passes. We also provide bereavement services to anyone in the community. Hospice families, of course, are free, and sometimes there's a nominal fee for anyone who is in need of support and bereavement services. A couple services I'd like to point out about our bereavement services, which many people are not aware of, is we have a very large Healing Hearts program. And that's for children ages 4 to 18 who have lost a significant family member, whether it's a parent, a sibling, a grandparent that has a significant impact in their life. Our Healing Hearts program meets September through June, like about twice a month, and it's really a robust program and very beneficial to children who need bereavement services. We also provide crisis intervention program. So if there is a tragedy, a crisis in a school, in a business, in a congregation within Rockland County, we send a bereavement counselor out to meet with the organization to determine what type of services they need, and we provide those services to them.
And of all your services are tremendous, but that last service is not one that I think that folks are really as much aware of, and they really should be, because I can tell you that years ago when I was the Chief Operating Officer over at Camp Venture, we had unfortunately a sudden death of a developmentally disabled person in one of the group homes.
That's correct.
Younger person, and hospice was great. I'd reached out at the time to Bonnie Walsh, a wonderful lady.
Yes, we miss Bonnie terribly.
Yeah, very much so. Bonnie and I were in Leadership Rockland together, and many years ago, and unfortunately Bonnie passed away a couple of years back. But Bonnie, I reached out to Bonnie at the time, and we had bereavement counselors that came in, which is great because they worked directly with the staff in the residence as well as the residents.
That's correct.
And and it was kind of a twofold approach, and they just did a tremendous job. I couldn't say enough good things about that experience with hospice. It was about 15 years ago.
Oh, wow, that's wonderful to hear. We do provide bereavement services to anyone in the community. So it's important for anyone who lives in Rockland to know that even if they didn't use hospice, they could still come to us for bereavement services.
Right. And talk to me a little bit about the Joe Rosso Hospice house.
The Joe Rosso Hospice residence, that was based on the needs of this community, and it was many years in the making and a lot of fundraising, and the Joe Rosso, as well as Tess McCormick Rosso, were instrumental in helping us with the funding for that, and that's why the residence is named after Joe Rosso. But we opened the residence in 2012. So it's just about 6 years now. It's just 6 years. And it's a 10-bed facility, and it's really a beautiful facility. It is like a home. It is not a hospital. It is not an institutional setting. It is really for patients and families, for whatever reason they can't stay at home. It's an opportunity for them to be at the residence where they get 24/7 on-site care.
Right. It's a really beautiful place, and I know that we have some photos that we can put up that really kind of show the beauty of the house and the property. And it's a place that's brought some notable visitors. I think one of the photos is of Cardinal Dolan,
Yes.
who did a visit earlier this year to the place. And it's a wonderful addition to our community. About how old is the hospice house, the residence?
6 years.
6 years.
It was opened in 2012, and it provides the same care, all the hospice services. It's just on site at the residence, and the nursing now is really 24/7. What's different in home care is you have a nurse on call 24/7. In the residence, the nurses are there 24/7.
Right, and it's just some beautiful grounds. It's in a beautiful part of our town in New
North
City,
New City, yes.
North New City, and not too far from Nature Preserve, which provides some additional buffering, and with the pond in the front, it's really just a beautiful area.
It's a beautiful setting, and we've done a lot aesthetically to make it pleasing and appealing to families to stay there. We encourage families to stay and be with their family member who is in hospice care. We have an outside patio where you could grill. We have a gazebo. We have a nature trail, a contemplation trail that was recently built, and that's really just for family members and patients to get outside, enjoy the nature. We have a vegetable garden that we have there, so all of our vegetables are homegrown. And a beautiful kitchen, family area. We have a library. We have everything there that will make it as comfortable as possible. And in a patient's room, you also have additional seating, and you have a bed where family members, a convertible bed, a couch that converts to a bed where family members can stay as well.
Right, and again, it's just a really important facility within our town, within our community. And I can't say enough good things about it. Unfortunately, if you need to have this level of care, it's a wonderful place where people can leave from this world to the next.
That's correct.
And their families can really have that support that they need, and that opportunity to really assist their loved one in some really dark moments, to have a bright place like hospice.
That's correct. It's one of the most difficult and challenging times that an individual and their family will go through when they're diagnosed with a serious illness. But we are here to help support not only the individual, but the family members as well, because the family member needs a lot of support as well. And we want to make everyone as comfortable and happy and enjoy the quality of life for however long that may be.
Right. So we only have about a minute left, but let's talk about how folks can help hospice, either to volunteer or to help with fundraising. You have an upcoming gala, correct?
We do. We have our annual Dancing with Our Stars Gala, which is on Sunday, October 28th, starting at 5 o'clock, and that is at the Pearl River Hilton. We are thrilled this year. Amy Stern, our Chief Executive Officer, is being honored. Not only is it Hospice 30-year anniversary, it's also Amy's 30-year anniversary. So we are honoring Amy as well as the esteemed Rand family for their continuing support of hospice. We are also thrilled that they wanted to be our presenting sponsor this year, Better Homes and Garden Rand Realty. And it's a fabulous night. I don't know if you've ever attended the gala,
absolutely.
but
Absolutely.
it is the dancing. We have 5 dancing stars, and they're paired with professional dancers, instructors. So they've been practicing for many months. They put on a phenomenal show, and it's really a premier event, and it's really keeps growing every year. We anticipate it to be sold out this year, especially with Amy and the Rand family being honored. So we, ask you to please register early. Go on our website, hospiceofrockland.org, and you'll click under events, and you'll see the gala, and then there's a registration site. You could also vote for your dancers in advance. There's sponsorships available. There's journal ads available. So we really encourage everyone to come out and support this event. It is a premier event, and you will have a fabulous time.
It absolutely is. In fact, I've gone to it most years out of the last number of years, but and it's really been an enjoyable event. It's when you go on the circuit to a lot of different events. This Dancing with the Stars certainly stands out as one of the top events amongst the not-for-profits here in Rockland County, and I encourage everybody to get out there. Again, if you could just give your contact info if folks want to get in contact with you, so they could either learn more about this event or how they could be able to support hospice.
Sure. My name is Donna Branca, and I'm the Director of Marketing and Public Relations. You can reach me at 845-634-4974 or dbranca@hospiceofrockland.org. Our website is hospiceofrockland.org, and you can learn more about hospice, the gala, or anything on our website. So please contact me directly if you'd like to volunteer. We have a fabulous volunteer program coordinator. We have an upcoming direct care training session. So if you're interested in volunteering, please contact Carol Gallione or myself. We'd love to have more volunteers.
Great. Well, Donna, thank you so very much. And on behalf of myself, certainly my family has had to utilize hospice with my grandmother a number of years ago, and I just remark at and am in awe of the work of hospice. What Amy's been able to do there, and just the wonderful efforts of Amy and her entire team throughout the years. So I want to thank you for being a wonderful guest, but I want to thank you for the gift that hospice is to Rockland County.
Thank you so much. I appreciate it. And thank you for letting us come on the show and speak about hospice.
Right. And coming up, Dominic Philippone, a Vietnam-era veteran. Stay tuned.